Hello students, today we'll start with a new topic, that is the drug distribution in the hospital. So it's very important to know how the drugs is being distributed to different departments. So in terms we can say the drug distribution is defined as the physical transfer of drugs from storage area in the hospital to the patient's bedside, as the drug distribution system is divided into two parts, that is a inpatient and outpatient. Inpatient is basically divided into four different parts, that is a individual patient prescribing filling form. Second is your floor stock system. Floor stock system is divided into three. First is the charge for floor stock. Second is the charge non floor stock. Third is the non charge free floor stock drugs. Third is the combination of first and second, that is individual patient prescription filling system and a combination with the floor stock system. In this there will be a two model, first and second. The fourth classification is the unit dose dispensing method. This method depends upon the centralized unit dose dispensing, which we can say CUDD, and next is the decentralized unit dose dispensing. First, we will describe the dispensing of drug to the inpatients. So, inpatient services in which the drug distribution to the inpatient department can be carried out from the outpatient dispensing area, and the staff handling the distribution of drugs to out the patients can easily be carried out the distribution of drug in inpatient departments. In inpatient departments, it's always located on the ground floor or the first floor of the building, but it should be near to the outpatient department and centrally located so that the staff can easily reach there. The inpatient dispensing should be carried out by the pharmacist, which is held by the skilled and a qualified staff. Next, the inpatient pharmacy is a multifunction department for the storage, dispensing, manufacturing of IV fluids and parenterals, etc. The inpatient department is a great deal of nursing time, is consumed by the frequent tips or trips of the pharmacy to obtain the drugs and to supply the drugs into the department. As we have seen the classification of inpatient drug distribution system, first is the individual prescription order system, in which individually the doctor prescribe the drug to the patient, and the nurse will send all these prescription to the pharmacy, and these pharmacy fill the prescription and come back with all the medicines required according to the prescription to the nursing department. Like, the system is generally used in small and small private hospitals because of its revenue productions and reduced manpower requirements, and the systems requires the doctors to write the prescription in triplicate, each copy being of a different color. The ward sends these prescription in the pharmacy at the fixed time intervals, where the pharmacist will dispense the prescription for each individual in a separate container or a packet, and these packets or the containers are then distributed by the pharmacy person to the respective ward from where the prescription has been received. The advantage of this system is all the medications orders are directly reviewed by the pharmacy, and there will be a less chances of the medication errors, and it also provide the closer liaisons among the pharmacist, physicians, nurse and the patients in the medication matters. So these are the code of ethics of the pharmacy, It provides the closer control of the inventory also. So like what all the drugs are going out of the pharmacy and coming into the pharmacy. But there is some at disadvantage also, like there may be a possible delay in obtaining the required medication for administration to the patient, and increase in the cost to the patient. Next class is the complete flow stock system. In this Under this system, the nursing station is a carrier both the charge and non-charge patient medication. According to this medication system, the drugs are stored at the nursing station and are administered by a nurse according to the chart order of the patients, and these chart orders are prepared by the prescription which is given by the doctors during the rounds. Only the commonly used drugs is considerable quantities are stocked on the floor stock or in the ward, that is your ward stock. Rarely used or costly drugs are not included to the floor stock, but dispensed when the order is received from the individual patients. Next is the mainly this system is used in the hospitals where the charges are not made to the patients. It all the charges are being added in the billing after the discharge of the patient. They have to pay the bill. What are the advantage of this system? In this, the drugs are readily available for the administration with a minimum return of drugs, and reduce the inpatient prescription order, and there will also a reduction in the number of pharmacy persons required, because like in a individual system we require a different number of pharmacy persons. Disadvantage: it increases the chances of medication error due to the lack of the review by the patient. Just like in the first system, it is been reviewed by directly by the pharmacist, but this system is not reviewed by the pharmacist. In this, the drug is directly given by the nurses. Greater opportunity for the misuse of the drug, resulting in the financial loss also, because we cannot maintain the inventory due to the increase in the drug inventory, and there will be a increased chances of drug deterioration due to lack of proper storage facilities also. It also increase the workload on the nurse due to the medication activity, because they have to take care of the patient as well as to the caregivers. Drugs on the nursing stations are known as the floor stock drugs, and they are classified into two: charge and non-charge floor stock. Charge stock are the charge floor stocks drugs are those for which the patient is charged for every single dose administered to him, and the selection of these drugs in various ward is decided by the pharmacy and the therapeutic committee. And non-charge are the dispensing drugs, are the medicaments that are placed at the nursing station for the use of all the patient on the floor. For these drugs, there shall be no direct charge from the patient's account, where we prepare a drug basket method is adopted, where the nurses check the medicines in all the rooms and prepare a master list for the pharmacy. And alternatively, we are using a mobile dispensing units which can be utilized. Next is the combination of individual drug order and flow stock system. This system is used in those hospitals where the patient pay for their hospitalization, and the hospitals use the individual prescription order system as their primary means of dispensing, but have the several drug in the floor stock. Next classification is the unit dose dispensing system, in which the unit dose dispensing, the multiples of single dose administration of medications are prepared by the pharmacist, which are ready for the administration to a particular patient by the prescribed route and the prescribed time. and a single unit package is one which contains one complete pharmaceutical dosage form, like one tablet, one capsule, or 10 ml oral liquid, like this. This unit dose dispensing divided into two: centralized and decentralized. Centralized, all inpatient drugs are dispensed in unit doses, and all the drugs are stored in central area of the pharmacy and dispensed at the time the dose is due to the given. Whatever the drug has to be given to the patient. And in the decentralized, this operates through the small satellite pharmacy located on each floor of the hospitals. The main pharmacy is for procurement, storage, manufacturing, and packaging. It serves to all the satellite pharmacies. As we see the advantage in this, the patient received improved services around the clock and are charged for only those doses which are administered to them, and the medications errors are decreased and because of the direct check by the pharmacies. Excessive duplication of orders and paperwork at the nursing station and the pharmacy is eliminated. Contamination due to the handling is also eliminated. Communication of medication orders and delivery systems are improved. Like the advantage, there are some disadvantage of this classification, that it requires more space since packaging material increases the bulk of the dosage forms, and it require increased number of skilled and laypersons in the pharmacy. Also it will increase the cost of the medicines due to the increased handling of the charges. So this all is about the inpatient department.